Okay, our last topic for the quarter, personality disorders. So kind of like I was saying earlier when you were asking about sort of the difference between personality disorders and others. So personality disorders are characterized by kind of disturbances in inner experiences, view of the world, that last, like I said, pretty much for the lifetime, especially like the adulthood lifespan. And generally, we're looking at people who just have, behaviors and thoughts that are very different, divergent from what is culturally expected or normal. Personality disorders in the DSM are split into 3 different clusters. They're called cluster A, B, and C. And within those clusters, the personality disorders tend to have kind of some overlap and some similarities. So we'll talk about those 3 different clusters in turn. And treating personality disorders is also very difficult. So kind of like I was saying with schizophrenia, people with personality disorders tend to have very little insight. They don't necessarily acknowledge that there's something potentially wrong that needs to be treated. And so they typically do not seek treatment. And if they, anytime you try to force someone to get treatment, that's usually not going to be okay. So like I said, the personality disorders in the DSM are split into these 3 different clusters. So there's cluster A, B, and C. Cluster A disorders are typically characterized by people who are very fearful and anxious. Kind of the main disorder in that cluster is called paranoid personality disorder. So we'll talk about those first in just a second. Cluster B are characterized by people who tend to essentially just disregard other people's rights. It's kind of the quick way to say that. The main disorder in that cluster is called antisocial personality disorder. And then the final cluster, C, are people who are, sorry, I think I got that mixed up. The paranoid ones tend to be more like odd, eccentric, awkward, and then the avoidant ones tend to be anxious and fearful. So I think I said anxious and fearful for paranoid, so sorry about that. So paranoid, awkward, odd, eccentric, antisocial tends to disregard people's rights, and avoidant tends to be anxious and fearful of social encounters. So we're going to talk about each of these clusters in more detail. Each cluster tends to have like 3 or 4 different disorders, but they have, again, kind of some overlap and some similarities. So we'll talk about each cluster in order. So starting with cluster A, the paranoid cluster. So the first disorder in this cluster is called paranoid personality disorder. Essentially, someone with paranoid personality disorder tends to be very distrustful and suspicious of other people. They tend to have kind of these delusions of persecution. So they tend to think that other people have harmed them, even if they haven't. And they just overall are not very willing to engage in social relationships because they don't trust that the other person has like their best in mind. Next is the schizoid personality disorder. So schizoids also tend to avoid social relationships, but they're not necessarily like suspicious the way that the paranoid are. They tend to just basically not desire social engagement. So they may not, seek out friendships or relationships. They may be kind of labeled as like loners, very solitary type of people. Schizotypal, they have some symptoms that kind of overlap with schizophrenia. So kind of like I was saying earlier, these can get a little bit confusing. It's like, how do you know if someone has schizophrenia versus having schizotypal personality disorder? And again, the main thing is someone with schizophrenia, their symptoms are going to be very intense. They're going to impair their daily functioning, and they may be a little bit short, right? They have to have it for 6 months to be diagnosed with schizophrenia, but it might only last that 6 months and then dissipate. Whereas someone with the personality disorder, with schizotypal personality disorder, they tend to not have as severe symptoms. They almost certainly are not going to have hallucinations or, like full-blown hallucinations, but they do have delusional thoughts, but they last for more like the entire adult lifespan. So just keep in mind, like personality, we're talking about a stable trait that lasts and endures for a very long time, that endures from, one situation to another. So someone with schizotypal, they may have those ideas of reference, like I was talking about with the newscaster itching their nose or whatever. They might have delusions of grandeur, sort of delusional thoughts, but not the full-blown hallucinations. and not necessarily like the disorganized thoughts and behavior that we see in schizophrenia. And again, they also tend to be very isolated. So one of the things that all three of these clusters have in common is that they tend to not engage in social relationships. They tend to be very isolated, off to themselves. And it's important because this will be a distinction later. They're usually by themselves by choice. They're choosing to be alone, either because they don't trust people or because they just don't have any desire to engage with people in general. So that's cluster A. Cluster B, again, the main personality disorder in this cluster is antisocial personality disorder. The main thing that all of these people have in common, all these 4 disorders, is that they have a total disregard for other people's rights. They tend to disregard other people's boundaries. They're totally fine lying and manipulating to get what they want in general in all 4 of these. So someone with antisocial personality disorder, sometimes colloquially, these are referred to as like psychopaths or sociopaths. So if you ever hear those words, the way that the DSM officially diagnoses it is called antisocial personality disorder. So someone with antisocial personality disorder, like I said, total disregard of other people's rights. They are more than willing to lie, to cheat, to steal, to get what they want from people. The main thing with antisocial personality disorder is that they feel absolutely no remorse for any of those decisions. So someone with antisocial personality disorder, they will do terrible things to other people and not acknowledge that they've done anything terrible at all, feel zero remorse or guilt for those actions and behaviors. Early on, they may show aggression towards animals, towards people. They may become violent. They may do things like destroy property, etc. They also can be like impulsive, irritable, aggressive. So that's antisocial personality disorder. With borderline personality disorder, these people tend to have very unstable emotions and also unstable kind of views of themselves and others. So they will kind of go back and forth between being very like loving and positive and happy, and then being very, hostile and rude and mean. They tend to have kind of delusions of abandonment. So they may think that someone is abandoning them just, if they're like going to the grocery store without them or whatever. It's like, hey, I'm going to go to the grocery store, and they say, oh, can I go with you? And you might be like, I kind of feel like going by myself. Then they might freak out and be like, okay, you're abandoning me, you're leaving me. People with borderline personality disorder are also very likely to make threats of self-harm, essentially to manipulate people into staying close to them. So if they're in a relationship, the person wants to end the relationship, they may say that they're going to hurt themselves in order to manipulate that person into staying, or guilt them, So they have a very intense fear of abandonment, is a pretty big thing with borderline personality disorder. Third one is histrionic personality disorder. People with histrionic personality disorder, they kind of need to be like the center of attention constantly, is the main thing there. And so again, they tend to have disregard for people's rights, but it looks a little different. So they may be willing to like lie and cheat to get attention. So they might tell some elaborate story about how amazing they are, or some amazing trip that they took, or something that never actually happened, just to get people paying attention and listening to them. And they often will feel very uncomfortable in social settings if they're not the center of attention. So if someone else is the center of attention, then they want nothing to do with that, and they will go out of their way to sort of put themselves in the spotlight, basically. So because of that, they can often be very dramatic. They may dress provocatively, either like sexually provocatively, or just dress in ways that will get other people's attention on them. These people can appear sometimes charming initially, but then they very quickly become kind of burdensome as they're constantly trying to be in the spotlight. All right, and then the fourth one in this cluster is narcissistic personality disorder. So people with narcissistic personality disorder, they tend to have very grandiose delusions. So they definitely will perceive themselves as being like the best at everything. They tend to be very overconfident in their abilities. They may try to do something that they've never done before and just assume that they're going to be great at it without any evidence to support that belief. They can be very pretentious. They tend to, though, crave admiration from other people. So they may initially appear very, very confident, but then if you dig just a little bit deeper, you realize that their ego is actually very, very weak and vulnerable, and that they constantly need kind of validation from other people. And if they're not getting that external validation, then they become very like self-pitying, and that inflated ego can shrink very quickly if they get any kind of like, criticism. They also tend to be very envious of others who are successful. So if they have a relationship with someone, that other person is successful in some way, instead of being happy for them, they often will be envious and jealous and resentful towards that person for their success. Okay. Oh, other big thing, I don't want to skip over, people with narcissistic personality tend to lack empathy as well. So they have a very hard time trying to put themselves in someone else's shoes, trying to see things from another person's perspective, because they're very self-obsessed, basically. They can only see from their very narrow viewpoint. Yes, Karen. Yes, you can be diagnosed with multiple personality disorders, yes. Yeah. In general, almost all disorders you could have multiple. I think the only one that we've talked about that's mutually exclusive is like the 3 big eating disorders. So those are, pretty much anything else you could be diagnosed with multiples of them.
So you could be antisocial, borderline, and narcissistic?
Yes. Yeah.
You could probably be all 4 of them.
Yeah, yes.
That would be terrible.
Yeah, yeah.
You'd
I
have
would,
to meet the certain criteria.
Correct.
Check the boxes.
yeah, yeah. I would guess there's probably clusters that are more common that co-occur, but I don't have that data in front of me. I don't remember seeing anything about that when I was looking at comorbidities. It was more just kind of like personality disorders in general tend to be comorbid with other things. But I bet if we dug around, we could probably find that there's, certain patterns, like probably people who are, probably people who are histrionic are not also going to be one of the cluster A, right? Because cluster A, they want to avoid social interaction, whereas histrionic wants to constantly be the center of attention, right? So you're probably not going to see overlap between certain ones, but there's others that probably cluster a lot. Yeah, so like I could definitely see antisocial and narcissistic probably cluster very frequently, would be my guess.
I bet if you looked into serial killers, you could probably find some that had it.
Yes, yeah, definitely, yeah. I will say too, just because it's a common thing that comes up, people often tend to think like sociopaths, psychopaths, you immediately think serial killer, murder, which like probably every serial killer was antisocial, but that doesn't mean that everyone who's antisocial is a serial killer, right? It's a very small percentage of people who have antisocial personality disorder are going to ever become actually violent in some way. Yeah, Karen. Yeah, I was going to say there are probably like politicians, CEOs of companies also have been shown to be very likely to have antisocial personality disorder. I mean, you kind of have to, if you get to the point where you're hoarding billions of dollars and not paying your employees enough for them to have a living wage, then you probably have to kind of have something like that going on, right? So, yeah. But not necessarily murders or serial killers, just terrible in other ways. Okay, cluster C, so the main one here is avoidant personality disorder. The way I think of avoidant personality disorder is someone who is like pathologically shy. So it's the point where they are completely socially inhibited. They're terrified of social interaction. But the difference here, so the reason with cluster A, I was emphasizing they choose to be alone. With cluster C, these people often desperately want relationships, but they just don't have the skills to develop those relationships. So someone who's avoidant, they often will chronically have feelings of loneliness. They want to connect with other people, but they feel often very inadequate. They feel like they're just not good enough to, be friends with people. They're not good enough to go to any social event where they could meet someone. They have basically just very, very low self-esteem. They tend to have a huge fear of rejection. So anything that even looks remotely like rejection will immediately push them away because they're terrified of that. People with dependent personality disorder tend to just be incapable of making decisions for themselves. So they constantly look to someone else to kind of be taking care of them, making all their choices for them. They tend to lack like an identity, a core sense of identity, and they usually will just latch on to the identity of whoever is closest to them. So if they manage to make a friend or be in a romantic relationship, then they will adopt, that person's musical choices and their clothing style and everything else from that person will then become their identity because they don't have a core identity of their own typically. They're dependent on other people to develop that for them. When they're left on their own, they typically have difficulty initiating tasks or engaging with anything. So they're, as the name implies, they're very dependent on other people to make those choices for them. And then the final one in this cluster is called obsessive compulsive personality disorder. So again, another one that's named like another disorder we've talked about. And again, the main difference is with OCD. That's, again, impairing daily function. They have severe symptoms that last for, a relatively short amount of time in order to be diagnosed. With obsessive compulsive personality disorder, it's less intense, it's not impairing daily function, but again, it's more general and it lasts for the entire adult lifespan. So someone with the more extreme disorder, with pure OCD, remember their obsessions and compulsions are about something specific, right? Someone with OCD, they're obsessed with cleanliness, they gotta wash their hands or whatever. Someone with OCPD, you put the personality in there, it's much more general. So they don't have obsessions about just one specific thing, instead it's everything. Everything needs to be tidy and clean all the time. They're obsessed with having like rules and lists. They're very inflexible, very rigid. So like in their routines, they have to follow the same routine every single day. They're very rigid in like their moral views. So they tend to see everything as like black and white, no nuance or complexity anywhere. What else? They tend to be obsessed with perfection. So they may have a hard time completing tasks or projects because they don't think it's done because it's not perfect yet. So they're going to keep working on it and keep working on it, and it's not perfect yet, so it's not done. So then they never get anything done because nothing's ever going to be perfect, right? So they tend to be obsessed with perfectionism. Okay. So those are the three clusters. Any questions so far about the personality disorders? Yes.
What would you say are like the main difference between OCD and social anxiety?
So again, it's kind of similar to the other differences I've talked about. So usually with social anxiety disorder, it's going to be much more intense. It's going to impair daily functioning. Someone with social anxiety disorder might not be able to go to work or class or whatever. And again, shorter time. I don't remember off the top of my head how long you have to have those symptoms for social anxiety disorder, but probably like, a couple months at the most. Whereas with avoidant personality disorder, again, it's maybe less intense, but it's lasting the whole adult lifespan. Yeah. I will say too, because I know this is probably confusing to a lot of you, it's also confusing to me sometimes, especially teaching this for the first time, not having like an extensive background in a lot of this, never having diagnosed anyone myself personally. I see there's a huge amount of overlap between these personality disorders and other disorders we've talked about. And even in your textbook, they talk about how this clustering system and the way personality disorders are organized in the DSM is kind of problematic, and there's not a lot of validity to it necessarily. So I would guess that's something that you might see change in future iterations of the DSM, that they might start to kind of combine these with the similar disorders and look at it more as like a spectrum, right? Like we used to break up autism spectrum disorders into all these different clusters, kind of like this. And then at some point we realized like, no, these aren't different. They're just a spectrum. And, anybody can fall anywhere on that spectrum, right? So I would guess really what's going on is that avoidant personality disorder and social anxiety are basically the same thing on a spectrum, right? And avoidant personality disorder is just a little lower on the spectrum, whereas social anxiety is higher on the spectrum, less, more dysfunctional, basically. So that's kind of how I tend to think of it, even though the DSM doesn't organize it that way. Yeah. I think the other big thing, too, to keep in mind is that usually people with a personality disorder, they lack insight because it's their personality, right? Like, this is just who they are. And so if you try to say to them, you know, I think you need help, I think you need therapy, they might reply with that. This is just who I am. If you don't like who I am, then go be with someone else or whatever, right? Whereas someone with social anxiety disorder, they tend to realize, like, I didn't used to be this way. Something happened that made me suddenly terrified of interacting with people, and I don't like being that way, so I'm going to go get treatment, right? So there's kind of that difference as well, like that insight piece is another component that kind of differentiates them. Okay, epidemiology, these again tend to be fairly rare, although I would say this is one of those where probably the numbers are much higher, and it's just difficult to get an accurate number, because again, these are not people who are going to be going and getting treatment and getting diagnoses. And so a lot of this probably just comes from survey data, where we basically send out surveys and ask people to fill them out, and then based on that, we kind of classify them, which you can imagine someone with antisocial personality disorder who's totally fine lying, they're probably not going to tell the truth on a survey like that, right? So then the numbers that we report are going to be much smaller than the real numbers that are actually occurring in real life. So even though these numbers are small, in reality, it's probably a bigger proportion of people that have these different disorders. So with cluster A, 2 to 5% of people in the population will meet the criteria for one of those cluster A personality disorders. Schizoid tends to be the most common, and they tend to be more common in women. So remember, cluster A, that's the one where we're distrustful of people, choosing to be isolated and alone. Cluster B, that's the one with like antisocial, borderline, narcissistic, etc. Only about 0 to 1.4% that meet the criteria. Again, keep in mind cluster B is the most likely to probably lie though, so those numbers are probably much higher. Borderline is the most common, and cluster B tends to be more common in men, probably especially like antisocial and narcissistic personality disorder. Those tend to be much more common in men than women. Cluster C, that's the ones that are like, overly shy, they're terrified of social interaction. It's about 0.6 to 5.2%, and those also tend to be more common in women. Okay, as far as comorbidities, so, and again, this is kind of just in general, someone who has any of the personality disorders is likely to then also have one of these other disorders as well. So mood disorders are very common. You can imagine, especially like the cluster C, someone who's chronically lonely, who cannot get the social attention that they crave. They're probably very likely to suffer from major depressive disorder. I believe those with borderline disorder are more likely to have like bipolar disorder, another mood disorder. So we see quite a bit of overlap between personality disorders and mood disorders. Then, as some of you have already pointed out, some of them are overlap quite a bit with the anxiety disorders as well. And then, like we've said a million times, substance use disorders also tend to be comorbid. Again, maybe self-medicating. Okay, as far as cause, it's a little hard to nail down, especially because, all these personality disorders are so different from each other. So really, if we really want to talk about etiology, we'd probably have to go each disorder one at a time and try to dig into the cause for each specific one. So we know there are some biological mechanisms, but of all the disorders we've talked about, this is probably like the least well-identified biological mechanism for these disorders. The ones that share symptoms with schizophrenia, so like schizotypal, for example, tend to have similar biological roots. So they have some abnormalities in some of the areas of the brain we talked about with schizophrenia. And there's also some evidence of, a strong genetic component with those as well. So antisocial personality disorder and borderline personality disorder, we've identified that there's deficits in serotonin activity in people with those. And they also tend to have deficient frontal lobe activity. So again, this is for antisocial and borderline. And they also tend to have an overly reactive amygdala. So they're more, sort of emotionally reactive for those with antisocial and borderline. All the other personality disorders don't really have an identified biological mechanism. There aren't necessarily changes in the brain or neurotransmitter systems. Some of the main descriptions of what causes personality disorders come from psychodynamic theory, which is, Freud's the whole, he's the one who started psychodynamics, and there's been people that have come after him. And essentially the whole, premise of psychodynamic theory is that things that happened in childhood triggered these personality issues. So, that could be the whole gamut of things, negative early childhood experiences, things like poverty, chronic stress, neglect, abuse, maltreatment, witnessing domestic violence, just poor interaction between parents and child, etc. All of those have been highly correlated with some of these personality disorders. There's also cognitive behavioral causes as well. So cognitively, people with personality disorders tend to have very maladaptive thought patterns. They tend to have a lot of distortions in their thinking. They may have like dichotomous thinking, kind of like I was talking about earlier. They see the world in like black or white. There's only two options. You can do this or you can do this. There's only right and wrong and nothing in between. So that kind of thinking. They tend to have just very negative, pessimistic views of the world as well. So just overall ignoring the positive and hyper-focusing on negativity. Behaviorally, so that things like conditioning may also contribute to some of these personality disorders. Basically being rewarded for acting a particular way repeatedly, or being punished for acting a different way. So like, for example, you could imagine a scenario where someone is punished for telling the truth and rewarded for lying, right? Like if the truth is I failed my science exam and I tell my parent that and they're abusive, then I might get in trouble for telling my parent the truth that I failed. But if I lie and I forge and I change the F to an A, then all of a sudden I'm rewarded for having lied, right? So then you can imagine something like that repeated over a lifetime. Then you're taught that lying is a good thing and telling the truth is a bad thing. So you may develop antisocial tendencies and be okay with lying to people and cheating to get what you want. So lifetime of conditioning and modeling can also lead to some of these personality disorders. And then this is very related to psychodynamics, but things like family dysfunction, childhood maltreatment. Another theory that's often used to try to describe personality disorders is called attachment theory, which you guys might have heard of. So attachment theory, basically this idea that in your childhood you develop a specific attachment to your parent based on them and their reactions to you. So, healthy people should develop a secure attachment to their parent where they feel like they can trust them, the parent's responsive to their needs, the parent is accepting of them. You could have an avoidant attachment to your parent where basically you just don't want anything to do with them. Or you could have, like a sort of more resentful attachment to your parent that's more tumultuous, where, maybe you want their attention, but you also pull away at the same time. And a lot of that's based on the way that the parent treats the child in early childhood. And you can imagine, right, how those interactions then would lead to personality disorders in adulthood. If you're trained from a young age not to trust people because you couldn't trust your parents, then you might develop, one of those cluster A personality disorders where you're paranoid, you're suspicious of everyone else, etc. So in general, childhood dysfunction is probably a huge contributor to a lot of these personality disorders. For treatment, not much to say here that I haven't already said. Like I said, it's very difficult to treat because they often lack insight and do not seek treatment in the first place. Oftentimes, if someone does come in with a personality disorder, it's because they came in for something else. They're experiencing anxiety or depression, they're having relationship difficulties, and they're oblivious to why they're having their relationship difficulties. So they go to see a therapist. The therapist might realize, wow, this person has antisocial personality disorder. But if the therapist tries to tell them, the reason your relationships keep failing is because you're lying to people and you're ignoring their boundaries and you're whatever, then they're probably going to just stop going to therapy because they're not getting the praise that they crave. So they're not going to actually get treatment for the real problem. Having said all that, the one therapy that may be somewhat effective is cognitive behavioral therapy. So training people to kind of adjust those maladaptive thought patterns, to be more positive, to view the world and people around them differently by changing their thoughts and then changing their behaviors. So, okay, any questions about personality disorders? Yes.
I don't have a question, but
Yeah.
another one that I know that they use is dialectical.
Mhm. Yeah. Yes, and again, probably mixed results. Yeah, very, very difficult to treat overall. Okay.
Narcissism treatable? Or would you say like?
Probably
That's why
not.
I'm like.
Yeah.
Or is it more like a learned behavior, or like how does someone come about like getting narcissism?
Right, yeah, I would say, again, it's probably, factors in early childhood is probably the main contributor. I'm trying to, I don't know if there's any, like, biological component necessarily. I feel like I remember hearing with narcissism, there's, like, deficits in frontal lobe activity to some extent. But yeah, I'd say probably not very effective treatments for narcissism in general. Because, again, the main issue is, are they going to be willing to seek that treatment to begin with? Yeah.
So it's like asses their whole life?
Yeah, pretty much. It's, yeah. There are maybe some very rare cases where someone might realize, maybe they take a class like this or something and they hear that and they realize, like, wow, that sounds exactly like me. Maybe there is something wrong, right? It can happen, but it's extremely rare. I think once there's that initial realization of, like, something's wrong and I need to change, it's possible, but part of it depends on the age, right? If someone comes in their early 20s and they've had this insight and they realize they have this problem, then you might be able to work through it, right? But if they come in at 50 and they've been that way their entire life, then even if they have that insight, it might be very tricky to try to untangle 50 years of being narcissistic and changing those thought patterns. So there's a lot of factors that would contribute, but I would say in general, all these personality disorders have very little successful treatment options.